All right, so we have moved back into our surgery suite, and we are now securing Isabel to the table. We do this, we have some leg ties on her legs, and this just helps keep her body in position because she's totally relaxed. We don't want her to start sliding over to one side or the other while she's under anesthesia. We have our sterile operating table here with our instruments, and I might say that both of our patients today are dogs that belong to vet students, and they both needed to get a spay and a neuter, so their students were kind enough to allow them to volunteer today for you guys to see how this works. We're going to get all of our monitoring equipment reconnected. Our other dog has just arrived. We're going to get him secured to the table and prepped and ready to go, and then we will be getting scrubbed in ourselves, and we'll get going. So myself and our two student surgeons, we have scrubbed our own hands and arms, and the reason for that is the same reason that we prepare both of these animals for surgery, and that we want to reduce the bacterial counts on our own skin in case we have a break in our gowns or our gloves so that we don't contaminate our surgery field. There's a very, very specific way that you need to scrub yourself, and I'll need a new glove. I'm stronger than the latex. My time at the gym has been paying off. Once you are gowned and gloved in, you are effectively sterile, and at that point you don't want to touch anything that is not sterile or you will contaminate yourself. So at this point in time, now that we are all blue, dressed in blue, we're not going to touch anything that is not blue or surgery green. While we're getting ready now, we're going to perform our sterile prep on this patient. So our operating room technician has placed her sterile gloves, and she is now using a sterile prep bowl and sterile materials so that nothing that isn't sterile is touching this animal's skin. And she is going to scrub this animal with chlorhexidine scrub, and that will then be blotted dry, and we'll be ready to begin the procedure. All right, so as the animals are being prepped, we're going to start getting our surgery packs unpacked, get the instruments out that we need. We're going to load a scalpel blade onto our scalpel handle, and one of the most important things that we are going to do is a preoperative sponge count. One of the most common surgical problems is a sponge being accidentally left behind in a patient. So we are going to perform a sponge count at the beginning of the procedure, and we're going to perform a sponge count at the end of the procedure and make sure the two numbers match. So once you're gloved and gowned in, although all of my gown is technically sterile, at this point now, I am the only part of me that is considered sterile that should ever come into contact with any of my instruments or anything else are my hands from the tips of my fingers to my elbows and the front section of my chest. Nothing else counts at this point in time.